I'm David King, and with Barry Welsh, who's in the ministry, we originated this thing that we call Knowing the People Planning, which was in answer to a question. The ministry or the governments have put in a massive amount of extra money into mental health services, and we know that's gone in, but have the people who are most in need benefited from it? That was the question we were asked. Are their needs being met? So we had two questions to answer. Who are the people and what are their needs?
A good performance measurement system also supports this government's key objective of a better, sooner, more convenient health system. And that's because a good performance measurement system enables us to streamline processes, reduce costs and improve quality. And of course, from a political angle, accountability to the public is absolutely crucial. Knowing the People Planning, KPP, is a practical approach that assists mental health services plan for and meet the needs of long-term service users. KPP is based on an easy-to-use survey to evaluate the experience of service users. This allows us to assess how well local mental health systems are working and to identify where improvement is needed. And personally, I'm a huge fan of KPP, and I'm very keen that all DHBs are putting this into place because I think it's a vital tool, and it seems to me that it's crazy that if it's not being used universally, and I think we're just about there, but there's one or two DHBs still to go.
This approach is designed to promote service user recovery, improve service provision, quality and efficiency. Service users, their family whānau, key workers, case managers, needs assessors established a detailed analysis of what is working and what needs to improve against 10 key elements. The 10 key elements are prompt access to service when needed, treatment leading to discharge and self-management, personal assessment and treatment plans, relapse prevention plans, continuity of care, health treatment and advice, social support, service accountability, coordination of services, and service evaluation. The evidence we have of those DHBs that are using KPP indicates a remarkable reduction in average length of stay and bed day use.
And in New Zealand, if you look at people who've been in contact with services for 2 years or more, it's about 15,000 of that order. The question then becomes the needs. And so nobody could tell us what the needs were. So we went and asked people who use the services, their families and whānau. They gave us these 10 key features, whether or not they've got a treatment plan, a relapse prevention plan, which is very important to help people remain well, and what to do if they become unwell to re-enter the service, whether they've got the right kind of appropriate medication, whether they've got a GP to be referred back to, whether they've got a home and a job. Now, it's possible, and we've done it for hundreds and hundreds of people, to collect that information and keep it up to date on a daily basis.
So some of the early observations we found when we started looking at mental health services was the significant variation in acute bed use, particularly on the South Island. And we also found that long-term clients were unknown and information systems couldn't tell services anything about the long-term clients. I remember going into a rather large DHB and we said, we think you've got about 1,500 clients, long-term clients, and we laughed out of the room. They said, we've got miles more than that, probably about 5,000. They were very gracious when we returned 18 months later when they'd actually looked at it, and our number was pretty close to what it really was. So there was no concept of how many people were actually in contact with services for a long time. KPP, as David said, we work from the ground with consumers, Maori, clinicians, management, to determine a set of, and came up with a set of 10 key features.
People that have been in the service for more than 2 years, they really easily describe their needs, whether people would like to address employment, their accommodation, whether their medication needs changing, whether they've got a GP. So it's really focuses caseworkers or key workers within services on some really basic needs, but that make a huge difference in people's lives.
It was a pleasure to hear all the things the Minister was saying this morning, because he mentioned KPP, knowing the people planning, which is something we've been passionate about and doing for quite a while in Hawke's Bay. So it's great to see the Ministry are supporting that and are behind that, because we believe it's a really good tool that can be used at an individual and team level to make things better for people who use our services.
And you heard the Minister today. I mean, as he said, he's an ardent fan. That's great, because it's practical, common sense and easy to do.